Good evening, everybody. I want to welcome everyone to tonight's virtual event. For those who joined us last time, I'd like to welcome you back. And for those of us who are joining tonight for the first time, welcome. As with last time, we are going to be accepting questions at the end of this, and we're going to be doing our best to try and answer some questions for you. So as we're going through tonight, please place any questions that you would like us to try and answer in the chat box below, and I promise we'll try and do our best to get to your questions when we're all done the presentation. With that, we're going to start our presentation. So tonight, what we're going to talk about is heart attacks. Heart attacks are a fairly serious issue, obviously, but we're going to try and add a little bit of humor to it. Hollywood has tried to present heart attacks in multiple different ways, and there have been lots and lots of people throughout Hollywood history that have portrayed heart attacks on screen. I'm sure many of you will remember the Sanford and Son TV show from the 1970s, and in my opinion, Fred Sanford, or Red Fox, was the person who did heart attacks best overall. In fact, he did them so well that he did them just about every single week on the show. With that, we're going to try and go to our first video.
I've never had pains like this before. Oh, this is the worst one I ever had, son. Oh, it's the worst one. This is the big one. I'm dying. You hear that, Elizabeth? I'm coming to join you, honey. Oh. Maybe that's Elizabeth.
So as you can see, he actually did some things during that video where he did grab his chest and clutch his chest. He actually grabbed off to the left side of his chest. He did say that he thought that this was the big one and that he was coming, and we're going to talk about all things that are truly classic to a heart attack in a little bit. Before we get to that, though, we're going to take a brief view of how not to treat a heart attack patient. Now, this video is actually much longer than what we're going to show you, but for copyright issues, we can only show you a small portion of the video. So I do encourage everybody to use their favorite streaming service to try and find this video after we give you a little bit of an example of it. But we're going to take a look at how Mr. Bean would take care of a heart attack at this point. Okay, so again, we can only show you a small portion of that video, but I do encourage everybody to go take a look at that video in its entirety. It's actually pretty fun. So we're going to actually talk about what really is a heart attack and what are classic heart attack symptoms at this point. A heart attack occurs when an artery feeding the heart closes. The artery actually closes suddenly, and it closes because a blockage that was in the artery suddenly ruptures. And when the blockage ruptures, the cholesterol that has actually created the blockage mixes with the blood, forms a blood clot, and shuts down the artery. When the artery closes, the heart begins to die. The heart is literally dying because it's not getting the blood supply that it needs. So what symptoms do we find with a heart attack? There are 6 basic symptoms that we're going to talk about. The first one, obviously everybody knows that in some way, shape, or form, heart attacks are supposed to cause chest pain. The chest pain that occurs with a heart attack has classically been described as pressure or squeezing or feeling like there is a ton of bricks on your chest, that there's an elephant sitting on your chest. People think frequently that the chest pain that comes from a heart attack occurs on the left side because most people have been taught that your heart actually is in the left side of your chest. That's actually not true. There is a reason why we have a breastbone, and the breastbone is actually there to protect our heart. So the heart actually sits in the center of the chest. So the most common location for chest pain that occurs from a heart attack is what's known as retrosternal, or behind the sternum, or in the center of the chest. The chest pain that can occur from a heart attack will frequently radiate to other areas, and this can be most commonly the left arm or left shoulder, the neck, the jaw, teeth, ears, into the back, sometimes into the right arm, sometimes into the right shoulder, sometimes even into both arms. Now you may ask, why is it that it goes to so many different places? Well, the fact of the matter is, even though the heart is an amazing organ, the heart has no pain receptors of its own. So when it comes to feeling pain, the heart is actually relatively stupid. Because of that, the heart has to borrow pain receptors from other places, most commonly the chest wall. And that's why you get the feeling on the center of your chest. Sometimes it will borrow from the arm or from the shoulder. Sometimes it will be the neck or the jaw. Sometimes it can be teeth. I've heard a whole lot of descriptions, but typically it starts in the center of the chest and radiates to other areas. The next symptom that we see with heart attacks is shortness of breath. Now, this is not shortness of breath specifically because it hurts to breathe. Even though the chest is hurting, patients who feel shortness of breath feel so because the heart is no longer pumping the blood that it needs to pump, because the heart muscle is literally dying. When the heart muscle is not pumping the blood that it needs to pump, the blood can actually back up into the lungs and you can develop fluid in your lungs. Patients will typically say, I had fluid around my heart. That is a whole different sensation. It is actually fluid in the lungs. Heart failure is fluid in the lungs or fluid in the rest of the body, and it occurs because the heart is not pumping the way it's supposed to. The next symptom is sweating. Doctors frequently call this diaphoresis. It is a specific type of sweat. It is a cold and clammy sweat. And it occurs because the same nerve that innervates the heart innervates the sweat glands. And when the heart starts feeling discomfort, it starts sending off signals to the body to tell the body that something is wrong. So because that same nerve gets triggered, frequently there is a sweating that occurs with this. Next. Our next symptom is nausea and vomiting. Thankfully, since we're after dinner, we found a picture that didn't actually show somebody throwing up, but nausea and frequently vomiting can be seen with a heart attack. The reason most commonly why this occurs is because the heart sits right on top of the diaphragm. The diaphragm then sits right on top of the stomach, and sometimes the heart being involved causes the diaphragm to become irritated, which then causes the stomach to become irritated, and this can cause nausea and vomiting. The other reason why nausea and vomiting is a common symptom is because, again, the same nerve that innervates the heart is the same nerve that innervates the stomach. And when that nerve becomes irritated, it sends some signals off to the stomach to tell it something is wrong, and the patient begins to feel extremely nauseated. In severe cases, the patient can actually vomit. And then our next symptom is lightheadedness. Lightheadedness is not always present, but it can be. It can occur, number one, again, because the heart is not pumping correctly and blood pressure begins to drop. But it can also occur because when a heart attack happens, the heart can become irritated and it can go into abnormal heart rhythms, which rob the brain of the blood supply that it needs. If the brain doesn't get the blood supply it needs, patients can become lightheaded. They can even actually pass out or lose consciousness. And then our last symptom, which is probably the most difficult to truly understand or describe, but it is always the one that every medical student remembers because it is the most interesting one to talk about, is a feeling of impending doom. Now, what does this mean? It means that a patient who is having a heart attack definitively knows that there is something wrong. They have a feeling like they are going to die. They don't actually have mild symptoms. The symptoms are specific enough that they know something is wrong, and they know that if they don't get taken care of, something bad is going to happen. Those are our classic symptoms. There are 6 of them in total, but they are not obviously all inclusive, and they don't necessarily all need to be present in order for someone to be having a heart attack. In fact, When people present for a heart attack, most people aren't totally classic, and not everyone reads the textbook of how to know when you're having a heart attack. In some cases, people don't have to have all of those symptoms, and in some cases, people can have none of those symptoms. There is such a phenomenon, thankfully it is fairly rare, but there is a phenomenon known as silent heart attacks where people will actually have heart attacks or they will close arteries without having symptoms. Diabetic patients most commonly are known for not having classic symptoms. Because of the nerve involvement with diabetic patients, they frequently will not feel chest pain. So diabetic patients may need to rely on some of the other symptoms such as shortness of breath or nausea, or just pure and simple knowing that there is something wrong with their symptoms to know that they need to be evaluated. In addition, women frequently are known for experiencing angina or heart pain differently than men do. Again, we talked about the classic symptom being pressure or a tightness or a squeezing. When it is described as to how women will typically feel pain, it is more frequently described as a burning or a dull aching sensation. It is generally described differently than men, and more commonly than not, women do not read the textbook more often than men do. So again, even though we have our classic symptoms for heart attack, there are other symptoms that are possible. This next video is actually put out by the American Heart Association, and it actually goes towards talking about women and how they present with heart attacks. So we're going to stop for a second and take a look at our next video.
It started out like a totally normal day.
Mom!
Okay, move objection deadline to the third line after survey.
Oh, honey, for when you always use the verb estar.
What are you doing down there? Did you finish your breakfast?
Ow.
Whew. Don't hit your brother. Honey, you have to eat something. Here. Okay, 5 minutes to carpool. Where's my coffee?
You okay, Mom?
Oh, I'm fine. Sandwich orders. What do you want?
Almond butter and jelly. Spaghetti. You sure you're okay?
I'm fine, sweetie.
I am so late. Hey, buddy, how you doing? Hey, honey. You okay?
Yeah, I'm fine.
You sure?
Oh, yeah. Here.
Acai, my favorite. See you guys later.
Wear your shoes. Put your shoes back on, please. Go help your sister. We're going in 3 minutes. Oh my God, what am I doing? I forgot to cut off the crust. Voila. Shoes on, potty if you need it. Honey, get your sister. Okay, here. Nobody move. I'm getting a dustpan. Oh.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack? I'm just gonna sit down. I'm totally fine. Don't forget to wear the high socks with the shin guards.
Forget about the shin guards, Mom.
Come on, Mrs. Underdog is not gonna wait. Whoa. Okay. 9, 1, 1. Hi, sorry to bother you. I think I might be having a little heart attack. Nothing really, just some nausea, tightening of the jaw, dizziness, shortness of breath, muscle pain, achiness, this terrible pressure in my chest. Oh, really? They can be here in how long? 2 minutes. Can you make it 10? I thought I had gas. Turns out I was having a heart attack. Heart disease is the #1 killer of American women. So now I take care of my heart, and I tell the women in my life to do the same.
Sounds great, by the way.
That's nice, sweetie, but that's not my heart. That is. Make it your mission to save your life and the lives of the women you love. Find out more from the American Heart Association at goredforwomen.org.
So that video was actually pretty good at demonstrating all of the symptoms that can occur during a heart attack. But it also is pretty good at showing how women will frequently not pay attention to the signs and symptoms that are going along with that and will delay their care. One of the things that we say in healthcare when it comes to having a heart attack is time is muscle. The faster we get the artery open, the more heart muscle we save. I can't stress it enough that there are some very important things that we should do when we are thinking we are having a heart attack. Out of all of those, by far, the most important thing is that if you think you are having a heart attack, you should call 911. Whether you think you can get yourself to the hospital faster than an ambulance can get to you there is not important. What is important is if you call 911, there are several different things that can happen. So number one, when the ambulance will get there, they can actually do an EKG in the field. An EKG is a strip that shows what the heart is doing at the time and can be diagnostic of a heart attack. If an EKG does show that someone is truly having a heart attack, that EKG can be transmitted to the hospital, and the team that takes care of heart attacks, which is the team in the catheterization lab, can actually be standing by and be ready by the time the patient even gets there. Again, the faster we get the artery open, the better. And the fastest way to get the artery open is to take someone to a cath lab. That brings me to the next point. When we look at the other reason to call 911, the simple answer is because not every hospital can appropriately take care of heart attacks. All of the hospitals around us are excellent hospitals. However, not all of the hospitals around us have cath labs. A hospital such as Spartanburg Medical Center, which is a certified chest pain center and does have a cath lab and does have a cath team standing by, can be ready and can be taking care of you. They can accept transfers from other hospitals, but if a patient goes to the other hospital, they are simply taking time, and time again means muscle. So when it comes to what we should do when we think we're having a heart attack or someone we care about is having a heart attack, we should call 911. The simple answer is call fast, call first, call 911. I'd love to take credit for that, but that's actually the American Heart Association who said that one. The last reason why we should call 911 is something that I mentioned earlier, is that when the heart is having a heart attack, the heart can become irritable. If the heart becomes irritable and the heart has an abnormal heart rhythm, the patient can actually lose consciousness, the patient can stop breathing, and if the patient is not cared for appropriately, the patient can actually die before they get to the appropriate place. If that patient is behind the wheel of their own car, they've now become a weapon, because if they lose consciousness, they lose control of their car, they can injure themselves and they can injure other people. God forbid their loved one is the driver and this happens, the loved one is clearly not going to be paying appropriate attention, and they can then also lose perspective, lose their concentration on the road, and become at risk for harming themselves and harming others. The important thing in all of this is to be under emergency care as fast as possible, and the best way to do that is to call 911. You're going to hear me say it over and over and over again. It is by far the most important thing. The next thing is, if you think you're having a heart attack, obviously, if you don't have your phone with you and you have to get up to get your phone, get up and get your phone, but stay seated as much as possible. Moving around increases the stress on the heart. It also, if you are at risk for having an abnormal heart rhythm, can put you into that abnormal heart rhythm. And if that happens and you're standing, you're going to fall down. So now we not only have somebody who has a heart attack, but we could have somebody who has an injury from falling down. If you are not allergic to it, and you know you are not allergic to it, you should take an aspirin. If you have a 325 milligram aspirin available, you should take a 325 milligram aspirin. If you don't, and you only have low dose or baby aspirin available, those are 81 milligram aspirins. You should take 4 of those. 4 of those will be 324 milligrams and will get you pretty close to the same as a full dose aspirin. The reason to take aspirin is not because it helps with the pain or it takes away the pain. The reason to take aspirin is because it is a mild blood thinner and it can start the process of helping to open up the artery. The other thing is anytime you think you are having a heart attack, go to the hospital for evaluation. Again, call 911 to go to the hospital, but always seek evaluation for a heart attack. If you have chest pain at rest that lasts for more than 15 minutes, it is a heart attack until we prove otherwise. If you have risk factors that suggest that you are at risk, you should take this seriously. A heart attack potentially means that heart muscle is dying. There is only one heart in your chest. There is one heart that should be taken care of, and it should be taken care of as fast as possible. In general, I hear people all the time who say, I don't want to feel embarrassed and cry wolf. I tell them all the time, feel embarrassed and cry wolf. It's what the emergency people are there for. All right. It is our job to determine whether or not you are having a heart attack, and it is our job to take care of you if you are. Putting off or delaying your care puts your heart at risk and increases the amount of damage that can happen from a heart attack. So again, if you think you're having a heart attack, call 911, you sit down, you take your aspirin, you wait for the emergency team to arrive. When they do arrive and they say that you should go to the hospital for evaluation, you go to the hospital for evaluation. Again, we're going to take the rest of this time now and open it up to some questions.
Wonderful. Thank you so much. We've had some really good questions come in across the chat while we were having the presentation. The first one, I have had a heart attack in the past. I feel like a ticking time bomb. How do I get back to normal?
Well, so if you had your heart attack taken care of in the past and your artery was opened, hopefully the amount of damage from the heart attack was minimized. The best way to not feel like a ticking time bomb is to have routine follow-up with both your primary care physician and your cardiologist. Having a heart attack is not a one and done thing. Patients who have had a heart attack have heart disease. Therefore, they should be following with their doctor and their cardiologist regularly. I recommend for patients who have had a heart attack that they follow with their cardiologist at least twice a year. They should have their cholesterol checked at least twice a year. They should have their blood pressure monitored regularly by their primary care physician and their cardiologist. If they're diabetic, they should have their blood sugar monitored regularly, and they should have a hemoglobin A1C, which is a test to determine how well your diabetes is controlled regularly. After a heart attack, one of the things that is very important is exercise. And one of the things that will happen is your cardiologist will refer you to cardiac rehab. There are a lot of times that patients say, I can do this on my own, I don't need the exercise. I still recommend cardiac rehab. It is a good support program that goes well beyond the exercise part of it. It is done in a hospital setting or close to a hospital setting. It's done by licensed exercise physiologists who will watch you on the monitor while you're exercising. They'll check your blood pressure before and after. They'll be teaching about nutrition during that time. There is a whole lot of information that is conveyed at that program. Programs like that are available at hospitals that take care of heart attacks. There is one here at Spartanburg Medical Center.
Wonderful, thank you. Another question we had is, I don't want to go to the emergency room every time I have palpitations. So is there anything I can do at home to tell if I'm actually having a heart attack?
So palpitations don't necessarily mean a heart attack. Palpitations are an awareness of your heartbeat. Again, if you think you're having a heart attack, the classic symptoms of a heart attack include chest pain that occurs in the center of your chest, particularly at rest, that lasts for more than 15 minutes, that doesn't go away with rest, or if you happen to have it and you've been prescribed it, that does not go away with nitroglycerin. If you think you have any of those symptoms, there's no reason that you shouldn't be evaluated.
Thank you. Another question we have is, can a heart attack cause a stroke?
So a stroke is essentially the brain version of a heart attack. A stroke occurs because one of the arteries feeding the brain closes. And neurologists and emergency medical technicians have actually now taken to calling strokes brain attacks. Can a heart attack directly cause a stroke? Possibly, but it is unlikely. And the only way that that would happen typically occurs after the heart attack itself. If the heart is damaged because of the heart attack and the heart is not squeezing properly, sometimes a blood clot can form in the heart. If the blood clot does form inside the heart and moves, the blood clot can then move outside the heart, bleed up to the brain, and that could cause the artery that feeds the brain to close. But a heart attack and a stroke are two different things.
All right. Another question we've got is, do people have heart attacks in their sleep?
People who have heart attacks are typically awakened from sleep if they are going to have a heart attack in their sleep. One of the things that we're commonly taught is that the most common time of the day for people to have heart attacks is in the early morning as people are starting to wake up. And the reason for that is because during that time, your body is releasing all of the hormones that it needs in order to get the body up and running and to get the muscles moving, to get your blood flow started. There will be a release of adrenaline. There will be a release of other hormones that are all served to invigorate the body and get you up and moving. It's during this time that a plaque or a blockage in an artery, if it is vulnerable to rupture, would be most likely to rupture.
Thank you. Another question, if I am with someone and they have a heart attack, after I call 911, what should I do for them?
Keep them as comfortable as possible, stay with them, talk to them, reassure them that help is on the way. You know, if they have not taken their aspirin or they have not had an aspirin, go and get the aspirin for them. If they are on medications, get their medications together into a bag so that when the emergency people get there, the medications are ready to go with the patient.
That leads into our next question. Isn't there a health risk for taking aspirin every day?
There can be a health risk for taking aspirin every day. In general, it used to be thought by cardiologists that, you know, an apple a day keeps the doctor away and an aspirin a day keeps the cardiologist away. One of the things we've actually learned over the past several years is that an aspirin a day may not be completely benign. What we do know is if you have had a heart attack or you have had a stroke, it doesn't matter how old you are or other issues, you are better off taking an aspirin or a medicine like aspirin that helps to thin the blood than you are not being on one. And that is simply because aspirin or medicines like clopidogrel, which is Plavix, or Brilinta, which is ticagrelor, or Effient, which is Prasugrel, all work to thin the blood and they work to help prevent second heart attacks and second strokes. So for those people, the health risk is far outweighed by the potential benefits. For people who are using aspirin for what is known as primary prevention or trying to prevent their first heart attack, up until the age of 70, the risks are still far outweighed by the benefits. However, over the last couple of years, there have been studies that have come out that show for patients who are over the age of 70, who have never had a heart attack and never had a stroke, there is actually potentially increased risk to taking an aspirin every day that does outweigh the benefit. And that is because of the risk of bleeding. And that can be bleeding in the stomach, bleeding in the head, or bleeding in the bowels. You know, those risks are particularly for patients over the age of 70, again, who have never had a heart attack and who have never had a stroke.
Thank you. Okay, another question that's come across. Do the symptoms of a heart attack start all at once, or can they be present for several days before the actual heart attack?
That's actually kind of a tough question to answer because everybody's a little bit different. There are some people who the very first symptoms that they ever have of their heart attack or of heart disease is that they start having a heart attack. There are some people who just simply don't have any warning signs that are coming on. Now, that being said, after the fact, when they start looking back on it, there may have been some symptoms that can lead up to it. One of the things that I frequently hear patients talk about, and I frequently ask a lot about when I'm seeing patients who I'm trying to evaluate for heart disease, is what their energy level is, or whether or not they feel more fatigued than normal. The heart is the engine that runs the entire body. And if the engine that runs the entire body is not getting the blood supply that it needs, the engine will run a little bit more sluggish, and that will cause the body to run a little bit more sluggish. So people who are potentially going to be suffering from a heart attack will frequently talk about that their get up and go has just got up and gone, that their energy is just seemed to have disappeared over the last several weeks. The symptoms of chest pain may have been present, but may not have been as severe leading up to it. So there can be chest pain that, again, doesn't last necessarily for 15 minutes. There may have been chest pain when they were up and doing things that went away. That's what's known as angina. Angina can be one of those symptoms. Shortness of breath can be another symptom. Again, particularly shortness of breath when you're up and doing things. But a lot of times, the very first symptom that some people have for heart attacks is simply the fact that they begin to have their heart attack. And that's because when you're having a heart attack, the artery that causes it closes suddenly. It's not something that happens slowly over time. It's something that happens all of a sudden, and it's because of what's known as plaque rupture or rupture of a blockage, that the cholesterol in the blockage mixes with the blood, and that mixture of the cholesterol in the blood forms a blood clot, which suddenly shuts down the artery.
Thank you. Another question. How long does it take to get my energy back after a heart attack?
Again, that depends to a certain extent on how quickly the heart attack was treated and how much damage was done. There are some patients who get to the hospital incredibly quickly and have very little effects to their heart after a heart attack, that within the day after their heart attack, they're feeling much better. Now, those patients will be put on medicines that they may not have been on before, and some of those medicines can transiently affect energy and can affect the ability to get up and do things. But again, everybody is different, and every patient will have different recovery times. Some of the recovery times are clearly based on how much damage was done to the heart. Some of the recovery times will involve what artery was impacted and how much of the heart was impacted by the artery that was closed. Some of it can simply be whether or not the artery was able to be opened or not. Not every artery that closes can necessarily be opened, and sometimes when doctors see the arteries that are feeding the heart that has closed, the decision sometimes may be made that it is too risky to actually try and open the artery at that point.
All right, thank you so much. Another question we've had come across. I experience chest pain sometimes after dark. Most of the time, if I lie down, once I sit up, it seems better, or I may take an aspirin. What are your thoughts on this scenario?
So anytime somebody has chest pain, I would always recommend that they have an evaluation with their doctor. Not everybody feels chest pain the same way. It was one of the things that I talked about during the presentation. Chest pain that is transient and goes away can be a warning sign for different things that are going on. And again, not every chest pain is necessarily related to the heart, but all chest pain should have at least an evaluation, if by no one else, by your primary care doctor. If your primary care doctor thinks that it warrants further evaluation, they will frequently refer you to a cardiologist or the appropriate specialist.
Thank you. Another question. My dad had a stress test that was supposedly normal, but then had a heart attack. How did this happen?
So stress tests are not actually meant to determine whether or not somebody is at risk for a heart attack. And the simple reason for this is that the blockages that show up on a stress test have to get to a certain percentage in order to be significant enough to cause symptoms. or to cause an abnormal finding on a stress test. And typically that blockage percentage has to be more than 70% for a stress test to be abnormal. The reason why stress tests don't predict heart attacks is because the majority of the blockages that actually cause heart attacks don't get to that 70% level. In order for a blockage to develop in such a way that it gets to that 70%, it has to be what is known as a stable plaque. A stable plaque is a plaque that the coating or the covering of the plaque is stable enough that it can grow and can expand, and it can actually begin to slowly close down the artery over time and get to the point where it is significant without rupturing. The blockages that more commonly cause heart attacks are sometimes 20, 30% blockages that, because of the way they formed, one of the areas on the blockage becomes unstable or becomes what's known as vulnerable, or that part of the cap that is covering the blockage is thin compared to the rest of it, and it presents an area where that blockage can rupture. And again, a heart attack happens because a blockage ruptures and causes a blood clot, which closes down the artery. So a stress test, while it can determine whether or not there is a significant blockage, cannot tell you whether or not there are insignificant blockages. And frequently it's the insignificant blockages that can go on to cause heart attacks.
Thank you. I think we have time for one more question. Do all heart attacks cause permanent damage to the heart? Why do some heart attacks kill people right away?
So thinking about that, if a heart attack is not treated in an appropriate amount of time, the heart muscle will eventually die. If the heart muscle dies, then that amount of damage that can happen from the heart attack becomes permanent. It is part of the reason why we say time is muscle. The faster we get somebody to the hospital, the faster we get them into the cath lab. If we can get the artery open and we can get it open fast, we can minimize any damage. We can actually minimize the damage to the point that it is only microscopic damage and shows up in lab tests and is not damage that impacts the heart or the function of the heart. The second part of that question is a little bit more challenging. And the second part of that question pertains more towards the abnormal heart rhythms that come from heart attacks. A heart attack that closes down particular arteries makes the heart more vulnerable to abnormal heart rhythms. And some of the reasons why the very first symptom that somebody has from their heart disease is they drop dead suddenly. And the reason for that is typically because when the artery closed, the heart became irritable and the heart went into an abnormal heart rhythm. If the heart goes into an abnormal heart rhythm, that is a lethal rhythm. Unless that rhythm is treated appropriately and treated fast, it's fatal. And that is what's known as sudden cardiac death. And that's when you hear, my brother had his heart attack and dropped dead on the spot. And it's typically because they've had a heart attack that's led to an abnormal heart rhythm. It's, again, part of the reason why, if you think you're having a heart attack, the most important thing you can do is to call 911. So since that was our last question, I want to thank everybody for joining us tonight. I'm sorry I wasn't able to get to everybody's questions. I appreciate everybody for participating in these events, and I hope that we can do these again in the future.